started. When the next panel, we've got Kune Park from CalYOUth, Candy Caceres from Director of Transition Age Youth Services at the Children's Institute, and if Candy's in the room, please come on up. And then Kookie Wells from First Place for Youth, Opportunity Youth Collaborative, Young Leader, Alliance for Children's Rights. So please welcome Kune Park. She's going to share our research on youth health and well-being.
Hello, everyone. Can you hear me from the back? Okay, well, thank you for joining us. My name is Kune Park. I'm a doctoral student at the University of Chicago. We are very excited to present the current findings today and looking forward to sharing this topic with you later. So let me just start by moving to the next slide and give you a quick overview of what I plan to share with you this afternoon. So let me see how this works. Okay, there you go. So broadly, I have three big domains of findings. I'll start off from youth social support, and from there, I'll move to crime and criminal justice involvement in this population, and then talk about youth health and mental health. Okay. I'll hold this. Can you hear me now better? Okay, thank you. It's okay, I hold it. Yeah, thank you. So social support, which I'll present in the next 4 slides, we asked about social support in 2 different ways. First, getting into the big picture, we asked youth what are their overall relationships in the big picture. And then second, in getting into detailed picture, we also asked youth to nominate supportive people, up to 3 people. So my first 2 slides will talk about overall relationships in the big picture, and the next 2 slides will talk about detailed information about their nomination. So the first slide shows the amount of social support that youth reported. So just to walk you through each support type, emotional support means youth has someone to talk about something private. Tangible support means youth has someone who can lend or give something that youth needed. And advice and guidance means youth has someone who can give advice or information. So the response options were enough people, just a few people, and no one to count on. Now, as you may see from here, from the number I posted, more than half of youth reported having enough people to count on for each support type. And then these little boxes show how many actual number of people they have in their lives in the number of 0 through 99. So on average, youth said 4.6 people for emotional support and about 3 people for both tangible support and advice and guidance. And in this regard, there was a care status difference. Youth still in care reported having a greater number of people to turn to for both tangible support and advice and guidance. And the second slide is about the amount of strain. This is about, in general, how much youth had strained relationships in their lives. So also to walk you through each strain type, disappointment means youth has someone breaking promise, and intrusiveness means youth has someone butting into their business or bossing them around. And criticism means youth has someone making them stupid, and conflict means youth has someone having fights or strong disagreements with them. So we want to look at how many said they have a lot of strain. So let's look at too many or some people, which is red and blue bars, the first 2 categories. I posted number up there. So disappointment and intrusiveness were the strain types that had the largest proportions of youth. And the next 2, criticism and conflict, were under 20% for too many or some people. And the strain size, so similar to what we did for social support, we also asked how many actual number of people do you have in strained relationships? Again, in the number of 0 through 99. When looking at the averages, intrusiveness, the second box, has the largest proportion, the highest average, 2.3 people, followed by disappointment, conflict, and criticism. So now we are getting into the detailed picture, which is about nomination, so social support nomination. In another question, we asked youth, please nominate supportive people up to 3. So response options were 0 through 3. Let's look at 2 or more people nominated, which is combining gray or maroon, the top 2 boxes up there. So first column, there were 2/3 of youth for emotional support saying they have 2 or more people. And then second column, less than 2/3 for tangible support. And the last column, over 1/2 for advice and guidance for having 2 or more people. And a very few said having no one for each support type, as you see from the red bar at the bottom. And the next chart is about youth's relationships with their nominated support. So that means when asking to nominate supportive people, we also ask them who they are. And we found that 39% of nominees in the red section were families or relatives by blood. And this was the most common group of people named as support. And the next 38% in the blue section were peers, meaning either romantic partners, spouse, or friends. So that tells family and peers consist of 77% of total support. And we also found care status difference in this regards. Youth still in care were more likely to nominate caseworkers for their social support, and youth who left care were more likely to nominate grandparents for their social supports. So this last slide is my social support domain. Because social supportive people can be also stressful in their lives, we ask youth, how often do you have strained relationships with the people that you just nominated as support? So strain was generally uncommon in relationships with people that they said supportive. And strain, so that is first 2 categories, which is red and blue bars, never and rarely, were the most common responses across all strain types. And then we want to see which strain type you said they had the most often. And then we're looking at often and always. The intrusiveness was the most common type of strain. And I'll pause for a second here so you can sort of compare across the strain types. So in summary, majority of youth has someone they could turn to. They were in regular contact with their supports, and family and peers consist of most supports. That is, youth still in care were more likely to nominate caseworkers, and youth who left care were more likely to nominate grandparents. And strain was generally uncommon in relationships with individuals that youth identified as social supports. And then my next slide, 3 slides, will talk about criminal behavior and criminal justice involvement in CalYouth. So the next slide shows youth's criminal behavior engagement in the 14 different questions. Overall, the majority of youth reported never engaging in the behaviors that are asked about. But most frequently reported criminal behaviors that is above the 10% line were deliberately damaging someone else's property, 16%, selling marijuana, 11%, stealing something worth less than $50, 10%, and taking part in a physical fight against another group was 10%. And there was a care status difference in one item, which is the far right in this chart. It might be hard for you to see in the far back. And that is, youth still in care were more likely to use someone else's credit card without permission. And then second slide is about criminal justice involvement. Overall, 15% reported having ever been arrested, 8% convicted of a crime, and 13% incarcerated at least for one night. And there was a care status difference. As you may see here, youth still in care in the red bars were less likely to report having ever been arrested, convicted of a crime, and incarcerated for a night. And also there is a gender difference, which is not presented in this slide. Males are more likely to have been arrested, convicted of a crime, and incarcerated. And the last slide is, in this domain, is victimization and perpetuation. As you see in the top 4 items under victimization, meaning witnessing or being exposed to violence. Overall, victimization was a rare occurrence for these youth. But the most commonly reported experiences were seeing someone get shot or stabbed and having a gun or a knife pulled on them. And the bottom 2 are perpetuations of violence, that is pulling a knife or a gun on someone and shooting, stabbing someone. And a very small proportion of youth reported perpetuation of violence. And there was a care status difference in this regard, in which I highlighted in red, that is youth still in care were less likely to report someone pulled a gun on them and someone beat them and stole something from them, and they shot or stabbed someone. So this means the items only in red showed statistically significant difference between youth in care and youth out of care. So in summary, most of the youth reported never engaging in the criminal behaviors, and criminal justice involvement was lower for youth still in care than those who left care. And overall, victimization and perpetuation of violence were rare. Youth still in care were less likely to report some experiences, which I listed here. Okay, and the last domain in this presentation is health, which I'll present in the next 4 slides. And this is about youth's general health rating between CalYouth and EdHealth studies. So let me ask how many of you are familiar with EdHealth studies? Okay. Okay. So this is good to, for me to present what it is. So EdHealth study is a longitudinal national survey collecting data on social, emotional, psychological, and physical well-being from early adolescence into young adulthood. So we compared between EdHealth and CalYouth studies in terms of other health items and employments, but I'm presenting health items here. So looking at the CalYouth sample on the left side, in the the first red bar, 24% rated their health as excellent. And then in the next 2 blue and gray bars, 58% rated their health as good or very good. And as you see here, youth in CalYouth, EdHealth study rated their health as better than CalYouth participants. And that is more CalYouth participants than EdHealth youth rated their health as poor or fair. And then second slide shows youth's information about suicide and mental health screen. As for suicide, in terms of the first 2 bars, 20% reported thinking about suicide since their first interview, and 7% reported attempting suicide during during that period. And the rest of the bars shows mental health information about prevalence rates for positive diagnosis. And the most prevalent mental health and behavioral health disorder was major depression, 10%, and alcohol use disorder, 9%, and substance use disorder, which is also 9%. And overall, in the bars in maroon, 14% screened positive for alcohol or substance use disorder, and 27% for at least one mental health disorder, and 34% for either mental health or substance use disorder. And also, there is a care status difference in mental health diagnosis. Youth who exited care were more likely to screen positive for manic episode, past, and substance dependence. And in terms of smoking, which is not presented here, there were 27% of youth reported ever smoking during the past month, and 24% reported ever smoking regularly, which means they smoked at least 1 cigarette every day for 30 days. And there is a care status difference in terms of smoking. Youth no longer in care were more likely to have smoked, and about twice as many youth no longer in care reported ever smoke regularly. Okay, and then my next slide provides information about youth's medical care. So the first 2 sets are about physical care, and the next 2 sets are about dental care. So first, we asked them, when did you have your last exam? And the response options are at the top. Less than a year ago, between 1 and 2 years ago, and more than 2 years ago, and then never. So as in blue bars, over 60% of youth reported having a physical exam and a dental exam in the past year. And then we also asked them whether they were unable to receive needed medical care. As you see in the green bar, 18 and 13% respectively reported being unable to receive needed physical and dental care within the past year. And then we asked them why. The most common reasons for not being able to receive needed medical care were not having insurance, not knowing where to go, and the lack of transportation. And also, there is a care status difference in this regard. Youth still in care were more likely to report having a physical exam less than a year ago, while youth who left care were more likely to have physical exam more than 2 years ago. And in terms of health insurance, pretty much most of them, 93% reported having health insurance, and 82% reported for dental insurance coverage. And there is care status difference. Youth still in care were more likely to report having health insurance and dental insurance. And my last slide for you today is about counseling, medication, and hospitalization. So the first column, within the past year, 27% reported receiving psychological, emotional counseling, and 15% receiving psychotropic medication, and then 6% receiving treatment for an alcohol or substance abuse problem. And also there is a care status difference. Youth who left care were not significantly to receive psychotropic medication, and more than twice as many youth who left care received treatment for substance abuse. And in the green bars at the very far right, the 9% reported being hospitalized for mental health, and then 31% reported ever being hospitalized for any reasons. The most commonly reported reasons for recently hospitalized for any reasons were pregnancy, illness, an injury, or an accident. And the average number of hospitalizations for any reasons was 2 times. So in summary, the majority of youth rated their health as being good, very good, or excellent. And about 1/3 screened positive for a mental health or substance use disorder. And most youth reported having a mental exam within the past year, and a very small portion reported using behavioral health services. Thank you for listening.
I start? Okay, I guess I'm starting. Can you hear me okay? Okay, thanks. My name is Lynn Kleist, and I am an LCSW. I'm with the Orange County Healthcare Agency. So currently I oversee the unit that provides intensive case management services to children that are in the child welfare system. Prior to that, I had the opportunity to oversee 4 contract programs that provided full-service partnership services to kids with who were seriously mentally ill. So not a lot of our kids, but there was a portion of our kids that were exiting the foster care system and coming to these agencies to receive their mental health services. One of the things that I noticed about kids who were leaving foster care system is, I think, the initial tendency to want to be done with the system, so to speak. And I think that kind of makes sense. Most adolescents kind of rebel against their parent. Well, they haven't had that opportunity. Their parent is the system, so to speak. So they're rebelling against the system, and they're individuating and trying to separate from the system. So I think it's great that we allow people to come in and out, as I think that, is a necessary factor. The other thing I wanted to just mention was some of the difficulties that I saw with kids who had mental illness and what services were available for them. One, I think it's really hard for social workers to kind of move out of the role of being the one who decides what's best for the youth and accepting the fact that the youth is now the one who gets to make those decisions. So there was some tension there, and we were a very recovery-based model, which is very client-centered, puts the client first and lets them drive their treatment. And social workers would be telling us, no, you need to have them do this. They need to be doing this. And we're like, no, we don't. So there was a lot of tension there with those programs. We'd have social workers who would tell us that they wouldn't approve a SILP unless it was in a supervised 24-hour setting. I said, well, those don't exist, and they wouldn't go to it if they were, but this is what we have. So I think there's some difficulties. I think there was some good things about having a specialized unit, because I think it kind of helps people to become better versed in those issues and better versed in the fact that I think it's hard if you had a client or a kid for a number of years who becomes an adult to kind of let go, the same as it is for a parent to let go and let them make some of those decisions for themselves. The other thing I think is that we had a lot of difficulties with housing for the mentally ill kids who were exiting foster care. The THP programs frequently, they had failed out of previously. We would unfortunately get a lot of phone calls where we just gave a 7-day notice. Can you find him a place to live tomorrow? We would get a lot of those types of referrals, and then there'd be the static of what they would fund as a SILP. So I guess what I'm trying to say is what was actually available that would house the youth was not something that social services felt comfortable funding as a SILP. So then the question became, then what? So if they don't qualify for SILP, they failed out of the THP programs, then what are the resources that are there to help them? And I think that was a big gap in the system. And I mean, it was one of the things that we were able to assist with, but I think that the most needy, unfortunately, aren't covered under SILP and extended foster care. There isn't necessarily programs for them. The last thing I just wanted to mention was we kind of did a small study on the kids that were in the FSPs that I oversaw, and we were looking at employment and so these are all kids with mental illness, and what they saw as their biggest barriers to employment. And there were some tangible things like transportation. That was easy. We buy bus passes all the time. ID cards, that's easy. We'll take you to the DMV. But the biggest barrier that they identified was self-esteem. And that one's not quite so easy to purchase for somebody or help somebody get that. So I think that's what we saw as the biggest barrier, and giving them little opportunities where they could be successful, and then hoping that that builds their overall self-esteem and helps them to be able to go forward. So that's all I have to say.
Hi, I'm Dr. Candy Caceres, and I am the director for ITSP, which is Individualized Transition Skills Program at Children's Institute. And we cover the southern part of LA County, which is service areas 5, 6, 7, and 8. For those of you that don't know the service areas, what that means is Watts, Torrance, Long Beach, Culver City, Santa Monica, Inglewood. I think I covered it all. Whittier, a large portion of LA County is what we cover. And this amazing program provides one-on-one mentorship for our transitioning youth ages 16 to 21. We help them for a span of 2 years, voluntary, of course, to help prepare them for adulthood. Whatever it is that they need to get them ready. And so I was surprised when I saw the stats on the diagnoses for PTSD. Really, because a lot of our kids, when they come in, they really do present with complex trauma. And so I was really surprised that it was really low. Other than that, I think that the stats really were accurate, in my opinion, based on what our kids share with us. But they are so busy surviving and trying to make it. They're trying to get their education, they're trying to get a job, they're trying to go off to college, they're trying to learn to drive, and then they have this trauma. looming over them. They're also depressed. They're also trying to figure out where are they going to sleep tonight. Are they going to have a meal? What do you mean I have to figure out a bank account? Oh, I have to go to financial literacy? Oh, what's this financial aid stuff? And so the one-on-one mentorship allows for that. And I think that this program really helps to buffer a lot of the symptoms they come in with. So when they have that 2-year consistent relationship, a lot of the symptoms that they come in with start to decrease. Just last night, we were at a CII board meeting, and we had 3 wonderful young kids come in to present, and they talked about how they came into the program feeling awful. They came in talking about how they used to isolate, they felt depressed. They had the label of foster youth, and they felt that everyone knew they were just the foster youth, and what that they felt that meant. But through the program, they started to realize that it meant nothing. It meant they were just a regular person. And one of the youth talked about how she's now at Cal State Fullerton on a full ride because she was able to do it. And she has that one-on-one mentorship, and she knew that she had someone she could call if it got tough. And the case is gonna close soon, but she can do it on her own. She no longer feels depressed. She's not isolating. Her major is communications. She wants to talk. But you know what? We don't work in isolation. We at CII believe in the integration motto. And so if we have parenting teens and they are fathers, we refer to Project Fatherhood. If they need mental health services, then we provide that as well. If they need just a peer support group, we find that for them. If we don't have it at CII, then we look for it. I think that's really what I have. Yeah.
So it's my turn. All right. Hi, guys. I'm Kamari Wells, or Kookie. You guys can also call me that. I've been in the system since 1997. It sounds very long when I'm only 20 years old right now, but I've been in approximately 7 placements, so you can kind of imagine, you know, the constant environmental changes that I was within. And when I was young, it didn't really bother me because I just ran with my imagination. Area was like my favorite movie, so that was the thing I always stuck to, you know. But as I got older, at the age of 13, puberty hit me, and that's when things started to change a little bit. In 2009, my beautiful mom, Jacqueline Wood, she passed away with a kidney failure because she excessively took pain pills, and I think that was a way for her to numb her vulnerability, which I feel like all of us, you know, have done. Not the pain pills, but, you know, food or, you know, stuff like that. But because of that, it was extremely tough for me, and the county thought it was necessary for me to see counseling, a therapy, and I agreed, of course, why not? And I created this bond with the therapist, and it was awesome. Then all of a sudden, randomly, they told me that they're going to switch the therapist, and I would no longer be seeing it because Medi-Cal doesn't work for it. And so that's when I became into the stage of isolation. I kind of took pride in being that independent Black woman because, you know, many of my family members who, you know, didn't have, because I also didn't know my dad, so many of my family members didn't have father figures in their life, so they just took it upon themselves to be very self-reliant, and that's how I was. But within those years before the age 17, 18, I noticed a lot of my relationships were extremely shallow. It was fun, it was exciting, I'll party, do whatever teenage people do. It was cool, but I just knew that something was missing. So I started to think outside of the box, and when I did that, I started to go away from what I was learned when I was growing up, and I was like based on religion and everything, you know, I was starting to think non-traditional, you know, because I didn't like the feeling of being shameful of my thoughts and guilty of how I felt. So I started looking into books. And then I randomly met this friend, and he introduced the idea of law of attraction and manifestations, and I got so excited off of that. And I remember grabbing a notebook and watching that movie full blown and just writing down all the things that I had. It made me feel so great. A little after that, I made a dream board, made sure to put my BMW 325C on there, you know, because that's what I wanted. And of course, and the living, because I wanted to come back to LA. I was from Riverside. That was my 7th, Aspiranet. But I wanted to go from Riverside to Los Angeles, and so I made sure to include that in my dream board. So while I was doing researching, actually looking just for housing, I came across something that I didn't even know, and that was the transitional program. I didn't even know that existed really, but I found it on the internet, made my connections, and I informed my social worker on that, and she was able to take me to the appointment at First Place for Youth, if you guys didn't know, but they're really awesome, by the way. And I knew that was the greatest opportunity to live somewhere where you have a roommate and you're free. But it was a wake-up call, definitely, because you can imagine living with someone who has a completely different background from you, you know, your own set of issues and everything. And so that's how it came. But when I first came out there, what I enjoyed is that when you first enter these programs, they give you these classes that you take, you know, that had to talk about mindfulness. It was very quick and short, but it's something that you need to do to continue being in the program. I did, but it was such a small, short of time. But I remember my first job being out there was Island Burgers, and it was great and everything, but what I wanted to do was to, okay, look, I was just really tired of the chicken burgers and the buffalo wings. Like, I was overeating that, and I wanted to make the conscious decision to switch over. So I got a job at LA Fitness, and also had the opportunity, because I love dancing, to teach my own dance team, the Middlebrooks Angels. So that was like an awesome opportunity for me. But then I also had to juggle the things that were going on at home, because it was challenging, okay? It was very, very challenging. There was a lot of things where I had to learn a lot of mental strength, because there would be times where you'd be tested, and if something happens, you're out, you're done, you know? And so there were many times where I had to step back and just observe the situation instead of reacting, feeding into the energy, and I just maintained my composure within that, and it turned out to be really great. I'm still in the program right now. I actually got the dream car that I wanted. And, I really just look forward to just doing everything that I absolutely love. And the two things that I focus on that I think is extremely important to all of us, and I'm sure we can all relate, is the active mind and the active body. So the active mind, I feel, is extremely important, because with us foster youth, especially with other people, you have a lot of things that run through your head. I don't know, 80,000 thoughts a day. That's what I've heard. I don't know if it's true, but that was something that's really big. And sometimes we do not know how to go about it. And because we're growing up and having all this baggage on us, it's stuck here and not set out there. And me going through that stage of being self-reliant, I was embarrassed to tell people my problems. I didn't think that it really mattered and I can do things on my own. And it caused me a lot of just chaos in my mind. And I even had to, sometimes it was so overwhelming that I would have to just tie on my shoes and just run outside just to release all the stress, Scientifically proven to get you feeling better, the good moods. But the active minding is extremely important, even if it's meditation or something in that sort. Creative expression where you're reading, because it's definitely stimulating for you, and writing and doing those things, if they're emphasized, especially for a youth, it can make a difference, because communication is such a big deal, and I think that's what we should all, really join into. And then the active body. But let's face it, everybody do not want to work out. That's just not everyone's thing, but it's also another outlet, I would say, especially for men, And for some reason, yes, we have all these things going on. We have, just housing and people that help you out for school, but sometimes we need that instant gratification. And if we were to just go on, just put on our gear and just bump heads, but in a, positive way, then it would make a difference in our lives, and that would release a lot of stress. And, just imagine, the many people that I'm, sitting in front of right now, the position that you guys got right now is because you guys worked on, stress coping mechanisms. You got into where you are right now, your status, because you worked there, and you also had the support. But just imagine if we can actually grasp that opportunity, if we had that outlet to go on. Thank you.
Lots to cover in health and well-being. But thanks, panelists. And now we have some questions, comments. I just had one question was raised around the prevalence of mental health disorders that we encountered. Just a comment about that. So first of all, and Kune said this, but I'll repeat it. That was sort of current mental health disorders among the entire population. And this is not the first study to see the prevalence of disorders decline over time for young people aging out of care from when they're in care. There's probably a couple of reasons for that. One, we have different disorders, like categories we put people in when they're minors and when they're adults, and some of them get a lot smaller when you're an adult. So conduct disorder, oppositional defiant disorder, those things actually don't exist for adults, and they don't map that well to adult problems. And then a lot of the behavior that contributes to those things, like, externalizing disorders, getting in trouble, actually declines a lot. And you see the report, and if you compare the answers to the questions that young people give us about kind of troubling stuff they get into, there's a lot less of it at 19 and 17. So that's part of it. The other issue is having a trauma history and having current symptoms are different things, right? So we're assessing their trauma history, but also are you, coping with symptoms right now? And there were a lot more of that actually at baseline than at age 19. So.
I was noticing, both from the data from the study and also from the comments of the other panelists, I think there's an issue of fit between some of our resources and youth. I was struck by someone saying that a person failed out of transitional housing. And then also like the history of like having a great therapist and then suddenly your relationship is severed. Sometimes people are like, these youth, they fail out of housing, they don't show up for mental health services. They know they have a problem with drugs or alcohol, but they don't go to treatment. And there's a tendency to think, these darn youth, they just don't do the right stuff. But I think the way some of our services are structured is not appropriate for young adults and not engaging to young adults. And I mean, just for transitional housing, think about, okay, I'm 19, I'm in transitional housing, I want to stay there, and my best friend has been beaten up by her boyfriend and begs me for a place to stay overnight, and she's homeless. What am I going to do? Or I found a puppy abandoned in a dumpster. What am I going to do? Both of those things will get me kicked out of my transitional housing. I take that puppy home, I take that friend home, bye-bye. But, I mean, really, what would you do? And so, I mean, and it's not that the transitional housing is bad, they have to satisfy their landlords. But there's this sort of structural mismatch between the needs and characteristics of young adults and the way that the things we have, like mental health, substance abuse, and housing, are structured. And I'm wondering if some of the data from this survey could help us structure those things in a way that actually works better for young adults.
Love to hear from, those folks who work in these systems may have some comments about that.
Well, I'd like to respond, and I completely agree that, and we need to continue to advocate. I specifically remember that one of our kids disclosed that she was suicidal, living in transitional housing, and so we right away jumped into action, got her some help, disclosed to the manager that she was at risk and had a safety plan. And so the reaction of the housing manager was that he wanted her out because she was a risk to their housing. And so I advocated. I could not believe that she expressed that she was feeling unsafe and she needed help, and his reaction was, well, she's placing our housing at risk, so she needs to go. And so through our advocacy and team effort, he allowed her to stay. But if it wasn't for our advocacy, she would have lost her housing. So I think that our systems need to continue to work together. Absolutely.
I would agree. I think there is a big problem with fit for the transitional age youth. I think that they want their freedom, they want their independence, they want to make decisions for themselves, and they are in a system who wants to tell them what they need to do. I get scared when I hear that we're going to have THPP be mandated or has to come first before SILP. Because again, I feel like we're trying to tell them what they need to do rather than partner with them and join with them and help let them decide what their course is. And I think, one of the things I really saw with the recovery model is we were okay with them making mistakes. We don't ever kick anyone out of, of the recovery of the STAY program, which is the program I use. I also used to say we are the program of infinite chances. So we don't kick anybody out. Nobody fails out. We just kind of regroup and, all right, that didn't work. What are we going to do now? And we try a different path. So I think I get scared, like I said, when people want to tell these young people what they want to do.
Exactly along Lynn's point in terms of youth being told what they have to do, and then they turn 18, legally adult, so they don't have to go to therapy, they don't have to take medication. I'd like to ask you, Kamari, and I appreciate your perspective, from your perspective and your friends' reality, how would you describe that sense of specific to medication and therapy? And I know you gave your individual situation, but how are youth reacting to that change of this is what you have to do in terms of therapy and medication to not having to do it and choosing not to? Does it work out? How's that transition?
Well, I was a person that never, was prescribed for pills, but it's interesting because my circle, I've had a couple of friends that has. I would consider a friend that was like my foster sister who did that, and it was extremely bothering for her because what I see was that she was okay. But they did it, she was on it for so many years that, it seemed like she kind of just adapted to it. But when she was off of it, everything was normal. But try to elaborate a little bit just for me with your question. Yeah.
It's exactly that point, that youth are being told what to do. How much do other people really understand what their needs are in terms of how they're reacting, and just being told you have to take medication for it? When they turn 18, don't take medication anymore.
Yeah.
And I was just curious perspective, and maybe from the study too, in terms of there's youth like all people that need medication and need a lot of extra support. Mm-hmm. But how much of it was you have to take this medication and suddenly they turn 18 and aren't taking medication anymore, and they're okay learning how to cope in different ways, exercise, support, those kind of things.
And meditation, I think that's a huge deal because you have to find a way to clear your mind. But when those things, because there was a moment of time where I started to silence myself a little because the people around me were telling me, okay, well, just what Sade said, I'm not sure if she's in here, but many people, I do believe that school is a necessity, but then I don't think that you need to be there for many years to achieve what you need to achieve. It just depends on your life and what you want to do, and I'm more of the creative side of things, but my point was, well, basically around that time I was very discouraged. It seems like that it made me feel, because there were so many people saying those things around me, it made me feel I was the only way that I needed to do it. Then I was researching. I always was in my books and just said there's another way, you know what I mean, that I can do things for myself and it can make it happen. But of course, if I present that to other people, then it's going to be kind of uneasy because we all have different beliefs. But until it happens, that's when people are going to be mind blown. So that's, yeah.
I appreciate your perspective, and thank you for advocating for other youth.
Thank you.
In terms of the data, did you want to say anything?
No.
Okay. This is not, so we see a reduction. This again, we're not getting into the longitudinal part of this, but we can now because we have 2 waves of data. We definitely see a decline, not just in prevalence of some of these things, we see a big decline in the usage of outpatient mental health. So that question that Kune shared, I think it was around 27%, something like that, said, yes, I'm seeing a counselor. It was almost twice that at baseline, right? So see a big decline in that. We saw that in the Midwest study as well. And actually, our study, the Midwest study, but also prior studies suggest that part of that is young people who are sort of told they need to go see a therapist while they're in care. Many of them decide, I don't really want to do that. Some of it's insurance, but in Illinois they had insurance. And even in Illinois, where they all had insurance and could go, many of them stopped doing that. Now, in some cases, that works out, right? In other cases, you see young people who, in any domain of functioning, think, I'm 18 now, I don't need that, whatever that is, right? And then, in California, they can come back into care again. So, but one of the interesting things I would say that Kune did mention, I want to draw your attention to, is one of the few places we see people who left care faring, sort of looking different in ways that suggest that that's not a random process, who leaves care and who doesn't, is the substance use and substance abuse of the folks who are out of care. And we need to look at that more longitudinally, but in my earlier study, we found that folks who at 17 who had substance use disorders were less likely to stay in care. Now, is that because of scrutiny? Is that, who knows? Or is that because they're impaired in their judgment and they say, oh, I could be on my own? I don't know. But I think there's a lot happening during this period that we're just beginning to understand. And the other thing that's happening that may be implicit in some of the things Lynn was saying is that the onset of some kinds of serious mental illness is during this period, right? So schizophrenia, these are relatively rare things, but this is when we first start seeing them, is during this period. And so on one hand, you have the Child Welfare Agency providing some kind of care, but you have an adult mental health services system that's going to need to be engaged with those young adults, because it's going to be there. If something's going to be there for them, it's going to be that system going forward.
Is it on? Oh, okay. I believe, yes and no, but I believe that seeing a therapist is very useful. One, because I have like trauma and kind of PTSD, so sometimes I feel the need to talk to a therapist. Yes, I feel like it's great, it's wonderful when they are there, but the part that they don't help you with is when you go home and then you have these trace thoughts, or you could be walking down the street and then you smell cologne or see flowers and it reminds you of something that happened traumatically, and then you're just like, well, what do I do? That's when you go into isolation, because you're like, I feel like no one can help me, no one understands where I'm coming from. And another thing, I feel like sometimes when youth go into foster care, I think they are misdiagnosed. For example, my sister, they told her she was bipolar and schizophrenic. I just felt like she just wasn't understood. I felt like they didn't want to deal with her, so they just said, hey, you're bipolar, sometimes you're happy, sometimes you're sad. Yeah, that's kind of the symptoms, but I just feel like sometimes kids, like, for example, when some people come around you, they have different energy. Some people make you happy, they make you excited, but then some people are just a killjoy. You're just like, why are you even here? So I believe it was that. And another reason why I feel like it may not be effective to your statistics, quote unquote, because we have trust issues. Like, we have a therapist, and then, like you said, we get comfortable with them, we tell them one thing, and then they just up and leave because they found a better job or a higher pay in their career of choice. And then it's just like you're forced to tell another therapist your whole life story all over again. So it's kind of discouraging, but helpful at the same time.
Hi, I just wanted to say a little bit of stuff. I was concerned in regards to the data that was represented in the presentation earlier, such as the 10% of youth that are living on their own. I was just curious, while they're funded through SILP, are they getting like essential life skill training? Is that mandatory, or is that an optional thing that youth are actually have the option of doing? Because I think that's crucial for all youth to have. whether it be, personal decision they might make. I think they should take essential life skill training because, I mean, realistically, I live on my own, and I had to learn how to iron, clean dishes, pay rent on time, pay my phone bill, and that's not easy. So I think that's crucial to have. I mean, money is too, right? But to be a responsible individual, you have to have responsible characteristics along with that. So that's what I was wondering if SILP comes with that kind of factor, that mandatory requirement to train all of our youth.
What I can say about that, well, I've never been in SILP, but I know people who have. And what they have is like IOP classes that it's not mandatory, but they give you rewards to kind of like, come on, join us, and that is, that's really why I went, because there was always food there to eat and, things to do, but it's definitely not mandatory, but I think it should be.
Definitely.
And I also think SILP should be extended into the age at least 24, because, when you're hitting 21 years old, you're still adjusting to the life of living on your own. So you're not actually making the amounts of money to, pay for rent and everything else. So it's a certain type of struggle. But 24 years old, that's when you're almost fully matured, mentally. And so you can get a lot out of that.
Yeah.
So we should jot that down.
Thank you.
Just to sort of take the 10,000-foot answer to your question, Congress spends $140 million on something called the Chafee Foster Care Independence Program every year. California gets more of that money than any other state. And the purpose of that money is just like it was back in 1986 when they started that, which is to give young people skills to manage on their own somehow. And there is a mandate, actually. States are supposed to have a plan for that and, expose young people to that. And we actually have a National Youth in Transition database where every 17-year-old at 17, we're supposed to know what they're getting. But that and $3 to get you a cup of coffee, basically, right? I mean, so I think that you raise a really good point, right? So what, in addition to wherever they're living, for example, if they decide to live on their own, and I think the statistic living their own from the earlier panel was of young people out of care, right? But you're right, so if they're on their own, do they have the skills to do that? And actually, believe it or not, the state of California has an obligation to help people that have decided to leave care, right? You're supposed to provide independent living services to 21. All these states that haven't extended care, they're supposed to be providing independent living services to age 21, right? So how we do that is a profound question, and I would editorialize here and say, when you're still in care as a minor, I don't understand why we wouldn't have foster care providers doing that.
True.
Most of us sitting in the room here, we didn't take a life skills training class. Like whatever we learned in terms of life skills, we learned where we lived. And it gets back to the question around permanency and relationships. I mean, this is a complicated issue. But in terms of learning life skills when you need them, there's some stuff you learn while you're at home, and then there's some stuff that you only learn when you're confronted with needing it. If you're like I was, right? Oh, now I need to find a place to live. Who's there to help me work through the skills and do that? So all of that's still here, even though we're providing extended care. There's that need to give those skills. So I really appreciate your question.
Thank you.
Good afternoon. I'm Michelle Wall, the Regional Manager for ILP, Extended Foster Care and Kiddos and Group Home for Riverside County. It represents about 3,000 or so kids, so just a small population that we serve. Part of what makes you a good researcher is being clairvoyant, because my question was precisely about the NIDED database. We spend a tremendous amount of energy achieving our federal outcomes around that database. In fact, my joke to my staff is she's going to our county admin center with a sandwich board if she can't help us get to 60%, right? So I'm curious about the NIDED database and the CalYOUTH study, how much of that is crosswalked with CWS CMS, and particularly around this topic area, because I think our data still is not good around the KDA lawsuit in California and what's known as Pathways to Health or Pathways to Wellness across the state. So obviously CalYOUTH, there's self-report, there's worker report, but what did you consider in your research, or would you consider in the future around NIDED and the CWS data?
Okay, so with NIDED, let me see how I can be politic here. As somebody whose study is the model for NIDED, right? So NIDED essentially replicates the Midwest study with a lower response rate and a much shorter list of questions, right? I think there's 22 NIDED items. So those are important items. And I think that it would be great if around the country we got, 90% of 17-year-olds, and we're able to follow up actually with more than 60%. That's the federal goal. I think that's the major flaw with NIDed. If you get 60% of 21-year-olds, you're missing 40%, and I can give you a sense of who those 40% will be, right? So they're not probably going to be the folks doing the best. So I would just, I think we need to do better than that with NIDed. California had a hard time with the first round of NIDed because your baseline NIDed data collection was really poor. So now following, I see my colleague Nate here who's tried to work with the national NIDed data. And so NIDed again is a work in progress. I think the next round of NIDed, get a better baseline response rate in California, get something at 19 and 21 that's got a good response rate. The nice thing about that is it's less expensive than CalYouth. The downside is it answers 22 questions. So I think we need to do more with that. With respect to the other question around mental health and stuff, so we're using administrative data. We don't have Medicaid paid claims yet, but maybe we will, right? So most of these young people, if they're getting mental health services, a lot of that's going to be paid for, not all of it, but a lot of it will be paid for with Medicaid. And I would say that's something the state of California should do more of. And I know that the leadership of CDSS, they have a data sharing, across systems group that Greg Rose has pulled together. And I think California could be a leader in that. How do you use the data you're already collecting, including NIDed, more effectively to understand, how young people are doing during this transition? The last thing I didn't say earlier, with respect to psychotropic meds, so look at the report. We actually have data at baseline, and with respect to this mental health stuff, in particular psychotropic meds, we know which of the young people are telling us they're using those meds, and we also have a series of questions of their experience of using those meds. And it's pretty interesting. I mean, about at baseline, about a third of them would say, I think the negative side effects of this are worse than the benefits I get from it. That's down a bit at follow-up. I don't know if that's because the adult mental health systems do a better job of matching them to meds, or that the ones that really aren't benefiting just refuse to take the meds now. But I think there are data in CalYouth that can be helpful that I think there are data that don't exist elsewhere in California around the use of psychotropic meds and why are they not using them, that kind of thing.
Okay, so I see like the data that we're collecting is decreasing over time, but we're talking about social workers and therapists, and we're saying how we need to get them to get better, but there's all these empty seats here, and there's all this space around here, so why aren't we bringing them in to listen to us and listen to the foster kids that, has success stories that made it through, and, I'm an OIC young leader, and it's like, I've been through everything that you're talking about, and it's like, we're collecting data, but we're not bringing them in to see it. We can tell them about it, one person can say it, but all these people are here to try to fix this, so why aren't the social workers and the therapists here, is my question.
How many folks are or have recently been, like, social workers working either in private agencies or public agencies with transition agents? Did you hear that? How many of you are currently either through, not-for-profit agency or county agency working with transition age youth? Okay, so we don't have all of them, but we do have some. I know that's a great question you asked. So we do have some of them here, so they are hearing you. And then the other thing is we got to work, and we're working with the co-investment partnership and IE Communications. You're here at the first release of this, right? The beast, as we call it. You got like a snapshot of the beast. And it's our job to dig down in those data, and it's our job to listen to you and other young people and other folks in this room about what we want to learn more about. And so this is really the first step, but I appreciate what you're saying. We need to take a lot more steps after this to get those folks listening to this and using it.